Everyone here at the Ohlendorf Appliance Laboratory is very excited to be able to offer the Inman aligner. If you're looking for an appliance to help correct orthodontic anterior relapse or align the anterior teeth, the Inman aligner is a great solution. It's the next generation of appliances for minor tooth movement. It is designed to align and straighten the upper and lower anterior teeth. One of its best features is the fact that there are no adjustments needed. There are no springs to activate or screws to turn to get the teeth to move. You simply seat the appliance, and the pre-adjusted appliance aligns the anterior teeth in about 6 to 16 weeks. In the past, doctors would use an appliance called a spring retainer to achieve some minor anterior alignment and relapse correction. This appliance is very rigid in the anterior, so you're limited in the amount of correction that you can achieve. Don Inman drastically improved on this appliance when he developed the Inman aligner. It's an excellent appliance that can be worn on the upper or the lower arch to align the anterior teeth. The appliance works with an active anterior component with springs that push up against the lingual of the anteriors and a facial component that pulls back against them at the same time. The combination of the pushing and pulling of the spring components provides the active force to straighten the teeth. By doing some slenderizing, you will create the space you need to line up the teeth, and the appliance will do all the work. Neither you or the patient have to do any adjustments. You simply seat the appliance and let it go. The springs also allow you to fully seat the appliance no matter how rotated the teeth are. You can compress and pull the springs as much as you need to get the appliance to fit over the teeth. Here you can see how the Inman aligner pushes and pulls on the teeth to get the sandwiching and squeezing effect to correct the rotations. You will need to do some slenderizing to gain the space to align the teeth. We provide an IPR guide to let you know how much slenderizing is needed and where to slenderize. With every Inman aligner, you will receive back from us a space and anchor placement report along with a printed final model. The first page of the report shows a picture of the model with the teeth reset. A movement chart is shown to let you know which teeth were reset and how they were moved. The next page shows a chin-up view of the models in occlusion. This will show you the amount of overbite and overjet you have at the end of treatment. You will be able to see if an interference may occur when the patient closes. We always try to avoid interference when we are setting up the teeth, but this picture will help you see how much space you have to work with. This report will show you a picture of the permanent model and a picture of the final model with the teeth reset. This is a nice feature to show to your patients so they can see what the final results will be before you begin treatment. The last page is our IPR and anchor placement guide. This page will let you know how much IPR is needed to align the teeth. Red lines are shown at the sites where IPR is needed. You will want to take an even amount from each site. We also show you where to place composite anchors. These anchors help hold the lingual and facial bows in place to direct the forces and prevent the bows from riding up their teeth. For more information about IPR and anchor placement, please give us a call. We have specific guides that provide more information for both of these that we can email or mail out to you. All Inman aligner cases are set up digitally. Once the teeth are reset, we print a model to make the appliance on. We return this model to you for your records. Many doctors find this useful when they do their IPR to see how to shape the teeth. The printed models can be used as a visual guide for you to see how the teeth should be shaped and the size they should be once the IPR and treatment is completed. If you have a patient you think will be a good candidate for an Inman aligner, just send us a set of working models. On the prescription sheet, please write, "Give me a call about this Inman aligner case." When the case arrives, we'll measure the model and contact you to let you know if the anteriors can be straightened using an Inman aligner. It is very easy to get started, and we're always available to answer any questions you may have. I encourage you to try an Inman aligner on one of your next minor tooth movement or orthodontic relapse cases. You and your patient will be very pleased with the result. If you need any information from us or mailing supplies, there are a number of ways to get a hold of us. You can call us or email us for assistance, or download any information you need from our website. We look forward to working with you in the future on your Inman aligner cases.